Hi, it's Dr. Noel Williams, November 16th, 2020, Optimal Health Associates, Oklahoma COVID update, U.S. update, sort of. So big day in Oklahoma. Governor Stitt had a press conference today and reversed course and put in masking requirements for all state employees because that's enforceable for him. Gave a very strong message on we all need to wear masks, we need to be socially responsible, community responsible. Lance Fry also talked about that. And then he addressed some of the high-risk areas, and this is, again, is data-driven, not emotional-driven, which seems to be a little bit of an issue with people. Data-driven is making decisions based on some type of scientific evidence. And the scientific evidence is that restaurants and bars are some of the primary spreading grounds for COVID. So limiting hours down to 11 o'clock, spreading the tables out, those types of things are very, very important, and I'm very proud and pleased of the governor to have recognized that the data had changed and how serious this is. Not that he didn't recognize it was serious, but again, that recognize that we do need to make some impacts, and he completely reversed course after much thinking and consultation with multiple people both inside and outside his administration. And a big shout out to Lance Fry, the health commissioner, John Budd, the chief operating officer, Bon Payne, the chief of staff of the governor's office, and Charlie Hamina, I have a hard time saying his name, his chief of communications, and then all the support staff in those offices who made this possible. Also, thank you to all members of the Central Oklahoma or Oklahoma City Inter-Hospital Task Force for COVID, and then all the people in the media, both at the Daily Oklahoman, Channel 5, Channel 4, Channel 9, who have supported our efforts to educate the population. And remember, today's just day one of the next phase. I say, to quote Churchill, this isn't the end, but it might be the end of the beginning. And so we're going to be moving forward. The state's going to be rolling out a whole bunch of public service announcements for education, and keeping the focus on educating people to wear masks and make good decisions, because ultimately that's how we're going to change minds. Where we are in COVID is very scary. We had 4,000 cases, I think, Friday, and been running about 3,000 cases the last 2 days. The hospital system is pretty much saturated. We're doing some efficiencies on the hospital level. The hospitals are. We're trying to offer some help with discharges, and hopefully we'll see an emergency order from the governor on some of those things in the next day or so, which will also help. We're still trying to figure out skilled nursing step down for patients who can be discharged, and we're looking at a whole bunch of other stuff. So again, great job everyone in the state of Oklahoma for participating and helping reach solutions. And I have a message for those of you who are on either side. There's a group of people who are just as mad today at the governor, and some of them have been directly mad at me also today for, well, you didn't get a mask mandate for the whole state, you didn't shut down every restaurant in town, and you didn't close every gym, and all of that. One, graduated responses make sense. And I'm not governing. I just offer my recommendations. But the first thing to recognize is we went from not a possibility of any restrictions or limitations or masking requirements at a statewide level. It wasn't even possible that was going to happen up until this weekend, and it happened. And so that's a huge step forward in terms of decision making and leadership. And remember, there is just as many people or more people telling the state officers that they don't want masks because and I'm not criticizing them, they just have their opinion on it. So we made a huge step forward. We should be very, very happy. And this is a major accomplishment for the state of Oklahoma. And there is redemption and forgiveness for people who adjust their opinions and try. If you always knew the right course from the very beginning, we'd all be brilliant. But I guess we all know there's only one person who's never made a mistake. If you're a Christian, but hey, we all have to work together to solve problems. This pandemic is bigger than any one intellect or any one person. So let's be positive and enjoy the momentary thought process of, hey, we're going to have less cases because we're taking steps on a public level to mitigate the disease event. So I think we should all be really happy. So if you didn't get everything you want, we still got something, so let's not belittle it, okay? And if you can only be negative about it, go away, all right? You can't change the world in a day. And I've been saying this repetitively, Rome wasn't built in a day, but everyone seems to forget with public policy development and deployment, it takes time, and it's developing trust and presenting data and helping people understand. And that's what it takes. And then likewise, if you're someone who thinks that this was a travesty because we're requiring masks and it's political, well, Governor Stitt's a Republican, has been pretty out there on being no, 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 no. And when fully seeing the data and getting lots of it from different sources, he made the rational decision to change course for the good of the population of our state. He didn't do it because he wanted to do it. He knows it causes economic hardship. He actually talks about this stuff when you discuss this with him, that each decision he makes is going to affect 4 million people, some for better, some for ill. But he has to make judgments that are for the population. And so his judgment at this point, based on the data, as a really pretty conservative Republican, was that no, this was a worthwhile step, and it sends the message that this disease is very, very real, very, very dangerous, very, very communicable, and we have to take steps to limit the possibility of spread because the hospitals are full. The hospitals are projected to double the number of cases in the next 4 weeks. It's going to happen. I don't know how they're going to manage it. I'm hoping we can keep these surgeries that are not elective but are called elective going through the end of the year, but we may not. And so we may need to think about how do we adjust things to handle that. But again, before you can cut off care to Oklahomans for diseases from other things from COVID, you got to try to limit COVID. And so you have to do limitations in a public setting first, which is what we did. And if you can't understand that, you're no different than the people on the other side who are angry that we didn't shut the entire state down. We have to, as to quote Julie Watson, the VP at Integris, who wrote that beautiful speech and gave that beautiful speech, it's trying to thread the needle, she always says, of the best course when you're trying to have all these competing interests and goals. And that's what governance is about, and you can't make everybody happy, but maybe all of us need to realize that being in the middle and appreciating the effort people make to help all of us matters, and to say thank you. I mean, would be my thing. So I have a big thanks to Governor Stitt as someone who's severely criticized him, and I would challenge any of you out there who are mad at Governor Stitt to have done what I did and crucify him online publicly for months. And he got over that. He made decisions, and he clearly, has made I can't say enough about the guy. I mean, and so there's redemption. He's leading the state, and I got a different perspective too from talking to the leadership group about what has been perceived versus what's been really going on. So we have some leaders that are trying. Let's give them a shot, and let's be supportive, because this pandemic isn't going away for a few months, and we all need to be on the same train, which is to improve patient outcomes and avoid death. So I think that's my summary tonight. I really want people to get on board. Get on board with believing that we can do things to help ourselves, and it's through engagement and discourse with people who you disagree with initially, and then you learn things that you don't know, and that decisions are made that you didn't understand. Well, now you understand why, and so it all kind of goes to show you never know enough about anything when you offer criticism, which I'm totally guilty of. So anyway, but I do think we need to be forgiving, be loving, be caring, and as we approach the Thanksgiving holiday, you can't put a whole bunch of people from different households together. That will be bad. You can do it with 2 households, maybe if it's a small group, 3 households, but everyone needs to be isolating beforehand. I would encourage if possible tests if you have that availability. No one should go to any of these things if they even have signs of allergies. So that's enough for tonight. I'm very proud of our state. I'm proud of our citizens for participating in the democratic process, and it shows that we can still get things done in Oklahoma through conversation, developing trust, and believing. Thank you.